Because again, today we'll be talking about diabetes, and more so, we'll be talking about the frequently asked questions about diabetes. We want to know, what is diabetes? What is type 1 diabetes, type 2 diabetes? How can you tell if you have or you are pre-diabetic? If you have diabetes, how are you able to manage that disease? What foods are you supposed to eat? We need to know everything we can about diabetes because we know it has become an endemic. Many people today are being diagnosed with diabetes. Some don't even know what to do, where to start. But on the set today, I have a doctor. His name is Dr. Teddy Jenga. Karibu sana. Good to have you.
Again.
So, in a nutshell, what you're saying is this: gestational diabetes occurs mostly on pregnant women. So after the pregnancy, their blood sugars goes back to normal.
Yes. So gestational diabetes it solves itself. So it has no cause.
Okay.
You cannot say that you got diabetes by doing this in gestational. It usually just comes by itself and goes by itself. So it can go immediately after you give birth.
Pregnancy.
Immediately after the pregnancy is gone, it can go by itself. And some take a bit of time.
Longer.
Even when the baby is growing 9 months, 1 year.
Okay.
It will take time, so you get monitored until it goes away.
Any expectant mother has to go the blood sugar. They have to have their sugar tested.
Yes, they have to go through the program, the testing program. So the first program is called ANC profiling, where you're put under a series of tests. We check your weight, blood pressure. It's a whole thing.
Okay.
And in our hospital, we've actually come to discover that mothers fail to know that they have gestational diabetes because they go and just start clinic just like that. So we put them in a program called Tembea na Dada, very specific to acute care clinic, where we walk with you since from conception to birth to the child welfare clinics. It's a new program and it's very comprehensive.
Okay.
So we walk with you from the time whether you have the diabetes or not. We walk with you until the baby is okay. 5 years and above.
What are some of the symptoms when someone has gestational diabetes? Is there any symptoms?
Yes, they are very close to the type 2 diabetes, the common one. The common diabetes is called type 2 diabetes or diabetes mellitus. It is characterized by high blood sugar.
High blood sugar.
Yes.
In your blood.
High blood sugar in your blood.
Yes.
So when there's an organ in your gut, it's called the pancreas. That has cells that are supposed to control the insulin. They release the insulin hormone that now control the sugar in the blood. So that sugar becomes metabolized. So in gestational and type 2 diabetes, that organ is not able to release enough insulin to metabolize that glucose in the system. So you find that there's a lot of blood glucose lingering in your blood system, which now is, when you test it, you always find it in the blood with the machine.
So basically you're saying type 2 diabetes and gestational diabetes is when your blood sugar is tested, their levels are high.
They are high.
So that means the insulin cannot take the sugar in the blood into the cells as they're supposed to.
There's a dysfunction.
So in a normal healthy person, once you eat food, insulin is released. It takes the sugar in your blood and takes it to the cell. Is that right?
It takes it to the cell. Now the cells absorbs the cell uses the glucose as an energy. It's as fuel to produce energy. So it metabolizes the glucose. So the hormone has to alert the cells to welcome the glucose in and then metabolize it and then now release energy.
So the symptoms are similar?
They are similar.
Let's name them, Dr. T.
The most common symptom is fatigue.
Fatigue.
A lot of urination, so frequent urination.
At night or
during the day? At night, yes. So you feel tired, you're always going for a short call.
And when you go for the short call, is there a lot of urine or just?
It can be any amount depending on the fluids that you're taking. But it tends to dehydrate you because you are losing a lot of fluid. And then your urine will tend to have certain characteristics. It will either be very milky kind of. It will be it will burn you in a bit. It will be have a very yellow discoloration. So it's not normal urine.
So basically, someone who has frequent urination is something you should.
It's something you should look at. There are other diseases that have frequent urination, but diabetes has that characteristic also.
It's one of the signs.
It's one of the signs.
You keep running to the loo.
Yes.
Okay.
And
fatigue, you mentioned fatigue.
There's fatigue because...
So you're not working, you're not overstressing yourself, but just you're fatigued.
You're just fatigued because the energy is not there. The glucose that is supposed...
Because the sugar is not getting to the cells.
It's not getting into the cells, so you feel thirsty because you're depleted of energy. You're depleted of sugar. So you just feel thirsty all the time.
Okay, so you're taking in a lot of water, but the thirst is not going.
It's not going anywhere.
Okay.
Yeah, and then there's that aspect of losing weight. Because you don't have energy, you're not metabolizing, the body starts to eat itself.
So you lose weight without even trying?
Without even trying.
Yeah.
So you are eating a lot because you're trying to compensate for the hunger, the fatigue, the frequent urination. But due to lack of metabolism, it just sheds off. Nothing is being stored or...
Unexplained weight loss.
Yes.
So that's something you should be on the lookout for.
Yes, yes.
Okay, another one, Doc?
Another one now is things like foot ulcers, the complications, where you just develop a wound out of nowhere. No injury, no laceration, your foot is the right size, your shoe is the right size, but you just develop a wound that is not healing. You've had how diabetic
people... I've had, because I'm glad you mentioned that, because I've seen friends or close friends of mine who their relatives were amputated because they had a wound which couldn't heal.
Yes.
So what makes the wound not to heal, Doc?
With diabetes, you see, if the insulin is not there to keep that sugar in check, and the cells absorb that sugar, or it just lingers around the system, the tissues, the immunity itself just disappears from that area. So the place starts to die. So that's how you develop a wound, because it forms something called a gangrene, dead tissue.
Dead tissue.
Dead tissue.
Which is prone to infection.
It's very prone to infection.
So the reason they amputate is because they want to stop
the spread of the death of the tissue.
But now that's a much later stage of
very
diabetes.
Complicated. But there are things that people, if you do not take care of the early symptoms, you will get there very fast.
Okay.
Yeah.
And I'm glad we're talking about these symptoms, because these are things we overlook.
Yes.
Because I've heard people say, "Ai, kwa nini nasikia nimechoka? Hakuna kitu nimefanya lakini nimechoka."
Yes.
And then you find this one I knew, Doc, about frequent urination. But when it comes to frequent urination, there is also a condition that happens with men concerning their prostate.
Yes.
As you grow older, for some reason you cannot retain urine. So how do you differentiate this is maybe pre-diabetic or this is just prostate issue?
It's always about the diagnosis.
It's always about the diagnosis.
It's always about the diagnosis, because symptoms can confuse you if you diagnose just from the symptoms. For example, you can never know you have high blood sugar by just the symptoms. You have to actually test it. You're putting a series of tests. Say for prostate, there are tests for checking for prostate, because also prostate has its own level of diseases. It's not just the cancer or the enlargement. You know, it's always a series. So you get diagnosed, then now you're told this frequent urination is caused by this or this.
So basically you're saying you don't have to wait to be sick to see a doc?
No.
With diabetes, is it advisable for people to get tested?
Yes. Before
even you have any symptom? Or
yeah, so for diabetes, what we really look at mostly, it's the genetics. I'm very sure those who have been diagnosed with diabetes, they always ask this question: is there someone in your family that has diabetes? So that's a question about inheritance of this gene.
But that is type 1 diabetes?
It's both.
Or even type 2 diabetes?
Yes, both.
It has genetic traits?
Yes.
Oh, I only thought it was only type 1 diabetes.
No, it's both, because for type 1, you have to inherit that that problem of your pancreas not producing insulin at all. So you are dependent on the insulin.
So in type 1 diabetes, doc, the pancreas literally stops to produce insulin?
Yes, it either stops completely or it produces too little, so you become dependent on.
And no one knows why?
Nobody knows. It's always the genes. So the same way people with eye problems, they inherit it from their parents. So it's usually a generational issue.
Oh, okay.
You just get it from your parents. So for the pancreas, the organ itself, you can inherit a bad pancreas from your parents.
Yes.
So then now you were put on insulin, and now you have to keep injecting yourself with the insulin.
That's type 1 diabetes.
That's type 1.
So you inject insulin because insulin is the hormone that takes the sugar from the blood to the cells.
Yes, yes.
So if insulin is not in the bloodstream, then all the sugar remains in your blood.
Yes, yes.
Now, there are complications that comes with too much sugar in your blood, like blindness.
Blindness, yeah. You can develop blindness because the same way you develop a wound in your foot or an organ failure is because if this glucose goes to a certain organ and then it gets accumulated there. With type 1 diabetes, it's your immune system that attacks the pancreas.
Yes.
So the same way it attacks the pancreas, it can attack other organs.
Wow.
So your immune system attacks your eyes.
Yeah.
It's not supposed to know your eyes are there. It's another conversation.
I also saw when I was researching for this show, Doc, that even your kidneys can be affected by it.
Can be affected.
You can even have kidney failure.
Yes.
Yeah.
Yeah, because now they are put on overdrive. They are always working to kind of get
rid of the excess sugar.
Excess sugar, excess fluids. There's something called osmosis.
Yeah.
So it's trying to balance between the water and the sugar concentration and the salt concentration.
Yeah.
So it's always overworking.
Okay.
And then your graph of sugar and it's just spiking. The spikes are the ones that make the kidneys overworking.
Wow, that's amazing. I did not know even type 2 diabetes is genetic.
It's genetic.
Because what you get when you do research, what you get mostly on the net is type 2 diabetes is a lifestyle disease.
It is a lifestyle, but the genetic aspect of it, it's now things like your body type. What your body is able to process. Yeah. Because it usually comes with lifestyle issues where you eat too much. So genetically, if you have big appetite, and then you grow big, you become obese, you're predisposed.
Oh, for real? So basically, people who are overweight are at a higher risk of developing diabetes.
They are at a higher risk of developing type 2 diabetes.
As opposed to someone who is fit.
Yes.
Yeah.
Yeah. So they say lifestyle because if you are just sedentary, you're not walking, you're not exercising, or you just office, like that kind of life.
Office, car, home.
Yes.
Escalator. You get it?
Yeah. So there's nowhere you're putting yourself into physical, exercise, and it should be on a regular because you cannot exercise for 1 year and then you say now I'm fit for life.
Yeah.
You have to put a sustainable program to stay fit.
Could it be the reason why, let's say 20-30 years ago, diabetes was not as common as it is today?
As it is now.
Because nowadays you have life conveniences.
Yes.
We drive, you take the lift, use the escalator. So we don't move as often as we ought. But back in the day, you go to the shamba, you get what I mean? So there was a lot of activity.
Yes.
So why is there so much diabetes nowadays?
It's lifestyle plus the type of foods we're having. Food has been reduced to just sugar. Food
is major.
Yeah, for example, the sugar we use in tea is totally useless.
It serves no purpose.
It serves no purpose. It's just for the taste bud then.
I'm glad you said that. I remember I was somewhere, and knowledge is power. And I said to a friend of mine, I don't take sugar. And then he said to me, kwa nini ukunywi sukari? Kwa nini unadhania diabetes inaletwa na sukari? But it actually is, isn't it?
Yeah, it causes inflammation because it's there to just give your pancreas and your kidneys a lot of work unnecessary.
For no reason.
Yeah. For example, if let's say you've taken something like a bowl of rice, just rice. Kenyans, we like rice so much.
Yes.
So you can just do rice, and then after the rice you do tea.
Yes.
You have just taken starch only. That is carbohydrates.
Those are
you have not balanced it. You have not put vegetables there that offers the fiber and the vitamin aspect. You have not put proteins, which are very important. The way carbohydrates and proteins and vegetables, the way they are digested is very different
from the way carbs are digested.
Yeah, carbs are digested very fast, so they tend to spike the sugars, and they tend to be converted into fat very fast because the body is storing.
So basically, let's also tell our viewers that carbohydrates, there is complex carbohydrates and simple carbohydrates. So sugars is simple carbs. That means they're easily digested. So a lot of the food we eat, like bread, isn't it? It's simple carbohydrates. Mandazi, chapati, smucha, you know, all those things. That means when you eat them, they're easily converted into, so you get the sugar rush. And even the drinks you're having, like soda, those packaged juices, they're horrible, especially energy drink. Talk to us about that, Doc.
Well, energy drink has been on the spot because it has a lot of chemicals. Yeah, it has the monosodium that usually even causes cancer. It has a lot of caffeine, a very disproportionate amount that the body doesn't need in that amount. Unless you're planning to take that bottle and run 10 kilometers non-stop sprint, you don't need all that energy at once packaged in a pill. So it has become a problem because we are overfueling ourselves. The body doesn't have a gauge to tell you you've put too much fuel. It doesn't have a limit. So whatever you put, the body will try and regulate it by either storing the excess energy or eliminating the poisoners, because it becomes poisonous in the body. Some of these molecules in the energy drinks, in the soda.
You know, I watched a documentary on YouTube. Basically, the guy was saying sugar is toxic. It is, isn't it?
It is.
Because, like you said, we don't really need sugar. The only reason why we consume sugar is because of the taste, isn't it? But there's no nutritional benefits to it.
There's no nutritional benefits. The only people that are allowed to just do sugar like that are people who their sugar just goes down for no reason. So those are people who produce excess.
I'm glad you mentioned that, because there is hyperglycemia
and hypo.
So hypo, explain please, differentiate.
So hypo is still a type of diabetes. Because diabetes just means excess or very little glucose in the blood. So if your body is not able to regulate the sugar, your sugar can go down,
which is also very risky.
It's very risky. So even when you are giving you medication or insulin, we usually keep very close. In fact, you're supposed to take measurements daily, so that your sugar doesn't go too low, it doesn't go too high. So if your sugar goes low all the time, there are things we give you, and we do not discourage that tea sugar from using it, because you might need it.
You might need it, yes. Or even glucose.
Or even glucose. That's why the sprinters and the marathon runners,
they use that a lot.
They use glucose because they need that energy, that quick energy, you know.
I don't know whether it was Kipchoge. There's a famous runner, athlete in Kenya, who said on the eve of a race, they carb up. They eat a lot of carbs.
They need the energy. They need the energy because for them now it's justified that this energy, I'm using it in the very recent future. But now if you stay in an office or you stay at home, you're doing calories and calories of just carbs. It will be stored, and it will be stored in those areas that.
So for example, let's break it down. I wake up in the morning, I have 4 slices of bread with butter and or margarine with a cup of tea with sugar. And then I go and sit on a desk, and then at tea break I have 2 mandazis, another cup of tea, and then at lunch I have chapati madodo, and then at 4 p.m. I have a samosa and tea. You see, I'm overeating, but I'm sedentary.
You're not taking that energy,
and I'm eating the wrong kind of foods. That is carbs.
The wrong type.
So what do you tell someone who is before even we got there, there's so much to cover. What is pre-diabetic?
Now pre-diabetic is now the stage. Everybody who is diagnosed with diabetes had a point where they were pre-diabetic. This is the point where you have not reached the unit 11. So you're just at the blood sugar level. Anything above 11 and it's not going low, you know, it's.
So what's the normal?
The normal is between if you have not eaten, they call it the fasting blood sugar in the morning. It should be anything 5 and below, between 5 and 3.9.
That's how it's supposed to be.
That one is okay.
Fasting blood sugar.
It shows that you do not have a lot of glucose in your blood. You need to eat. So you're almost starving. Normal is between now 6 to 11 at most. So if
when you are eating now, you are
Yes.
When you take the sugar when you've eaten.
When you have eaten. So if you have taken maybe the mandazi and the tea, and you're not diabetic, it should not go above 11.
Okay.
In fact, anything above 10, we just say there's a problem.
Oh, for real?
Yeah. Now when it goes to 11, it hits that 11 point, and then you come the next day, and then we check, we see it has gone down. Now you're told you're pre-diabetic because you're not stable. Your sugar is not stable. It's spiking and then coming back.
Wow, I didn't know that.
So after we monitor it for a while and it's still reading above 11, 15, 16, 20, then you are diagnosed as diabetic and you're put on the medication.
So between 11 and 12, you're pre-diabetic?
You're just pre-diabetic.
But beyond that, now you're diagnosed as diabetic?
Yes.
So when someone is diagnosed as diabetic, what's the first thing you do?
Once we diagnose them, we usually run them through now an organ function test where we check your kidneys, we do a kidney function, we do a liver function, we check the blood for anything excessive, maybe it could be your hormones are the one that are causing. We check also something called HbA1c. It's just a way of seeing how has this glucose been behaving for the last 3 months. So it gives us a level. Have your glucose been high throughout? Is your insulin okay? Are you producing enough insulin to keep this sugar on check? So we run you through that series. So if they show that you have a problem, the diabetes is seriously there, then now we go to now the lifestyle. Now that is where now the doctor recommends now nutritionist where they now start taking a history of what do you eat, how's your breakfast, how's your lunch, how much carb do you eat, we calculate the calories, we check your weight, we do something called the BMI. Now that's where it becomes important because we need to know your body mass index. Your height versus your weight. Are they the right level? Because you can be tall and big, but you be the right BMI. But if someone weighs the same as you and they are, let's say you are 6, someone at 5 weighing the same as you, that person is a bit overweight. So the height is also very important because of the bones. So after the test, now we put you through a nutritional counseling, and now we check your food. So we try to manage your food before we give any medication.
Oh, is it?
Yes.
For real?
So if your type 2 diabetes is caused by, because these people, they usually come in their 40s, 35, so they usually come from that age. Because
at that age, your metabolism is slowing down. So if you eat as much as you ate when you were younger, you're consuming too much and your body doesn't need all that, isn't it? So we should tell people as you age, eat less and eat right.
Yes, eat right. We say eat right. In fact, the eat less was very eat right.
It's relative. Right? Eating less is relative. Eating right is better.
So from that age, that's why now we see people coming in where now it's an accumulated lifestyle disorder where you've been eating maybe in between your teenagehood and your 30s, been eating very badly. You have not been doing a good diet, have been sedentary.
And maybe you've been eating and drinking. Is alcohol a cause?
Yes. So the pancreas, all the organs in the body are affected by the alcohol, including the brain. So you can, some people compare themselves with people who have been drinking for 40 years and they're okay, saying, why am I the one who's suffering from alcohol? It's very relative where some people just, alcohol just reacts differently with them. Their metabolism of that alcohol is so reduced to the point it's not able to get outside the body fast enough. So it becomes toxic and starts messing up with the organs, including now the pancreas and the liver and the kidneys. So alcohol, it's just a poison.
Literally.
And you cannot predict.
You can't.
You will know when it happens. It can cause liver cirrhosis, kidney failure. It can cause diabetes.
It can cause diabetes.
It can cause so many other. It can even cause the cancer itself.
Alcohol causes a fatty liver. There's a condition called
fatty liver disease. So there are two: non-fatty and non-alcoholic fatty liver and alcoholic fatty liver.
I'm glad you mentioned that because you don't have to take alcohol to have a fatty liver.
Yes. So fatty liver disease, there are those caused by alcohol and there are those that are not caused by alcohol.
So in a nutshell, what you're saying, Doc, is this. In order for you to be on the safe side as when it comes to diabetes, diet.
Yes, that is type 2.
That is type 2.
Type 1, you're diagnosed early in your teenagehood. Below teenagehood, there are those who are diagnosed at 9 years, 10 years. some are even at 5. At this point, young people are getting a lot of type 1 diabetes from the inheriting the genes. So those ones are supposed to be diagnosed early enough so that it doesn't cause other complications. Because the complication comes very fast. Once the sugar hits a certain point, 30s and above, the body is not able to function. You can even collapse. So that one is supposed to be diagnosed early, which we can even diagnose a baby.
Oh, so with diabetes, you can even lose consciousness?
Yes.
What makes you lose consciousness?
If your blood sugar is too high or too low, if it's too low, then your body just shuts down because of lack of energy. You do not have fuel. Just shut down. If now it's too high, it causes something called ketoacidosis. Or acidosis, it's where now acidity, so the body just becomes acidic. So there are some organs that are not able to operate within that environment. So it will start attracting water from the neighboring cells, so it will dehydrate you, but you have a lot of water. So you're dehydrated, but you're just full of water in the cells. And mostly it affects the brain, where now your brain sweats because it's trying to dilute all that sugar that is in the blood. So the blood in the brain has a lot of sugar. Osmosis comes in and tries to attract a lot of water to try and dilute it from the cells. So it swells, it increases in size.
Type 1 is managed by insulin injections?
Insulin injection,
And type 2?
Type 2 is lifestyle changes and now anti-diabetic medication.
Like glutamate
or metformin.
My grandfather was diabetic, and I remember I used to go get those meds for him. He would swallow one every day, and he took it for a very long period of time. So the ones that who inject themselves, that is primarily type 1 diabetes.
Yes, that's type 1. So when you're insulin dependent, you can use the other drugs, then now the glutamate and the rest, depending on how fast your glucose rises, or how much insulin you have helping you with now the supplementation. But the predominant medicine you use now, it's the insulin hormone, the synthetic insulin hormone, where you inject around the fatty area, thighs or the stomach. And
you have to learn how to inject yourself eventually.
You have to learn how to test yourself every day. You have to learn how to inject yourself, because there's some who even do it 3 times a day.
Wow, depending on...
But it has become easier, because nowadays you don't need to start doing syringes and vials and all that. There's a pen.
Oh, is it?
There's a pen. We have types of pen. We have the fast-acting pen and the long-acting, where you use it at night. So it just takes care of you during the night. So it doesn't have pain.
It's painless.
It's painless.
For
almost,
real? Some people are afraid of injections.
That one is almost painless, because you won't even feel it. So things have become less crude as we go because of technology. There are those who have insulin patches. You just put something and then it just dispatches the insulin for you.
Wow, I didn't know that. So people who have a phobia of injections, now they have an alternative.
There's always an alternative. So everybody survives. So that is for type 1, where you have to still check your lifestyle, have a nutritionist nearby who checks on you, and now the insulin, somebody who is guiding you with the insulin, and now clinics.
Clinics is a must.
We do clinics. Diabetic patients monthly, at least once a month.
You should go see.
Go with the readings that you've been testing, or go get tested in the hospital, and then come see us every month. Now we have the chronic illness specialists.
Another thing before I forget, Doc, type 1 cannot be reversed.
It can't be reversed.
Type 2, I hear it can be.
Most of the time it can.
Oh, for real?
So
it's just like gestational diabetes. It can be reversed.
It can be reversed. So depending on how far it has gone, if yours is caused by just obesity and poor diet, once you correct the diet,
your blood sugars now go back to normal.
They go back to normal. And we've seen it even with elderly patients, where they come, their sugars are off the charts. Once you modify their diet, the diabetes just disappears. Even when you give them the medication, now it kind of lowers it too much. So you have to remove the medication and put them on a good diet if they're able to follow it.
Tell us, Doc, what's the diet of someone who is type 2 diabetic? Give us breakfast. What do you give them for breakfast?
Unless that one I can try and just compress it a bit. For diabetic patients, we usually try to put them on a calorie deficit or a carbohydrates deficit, where
calorie deficit, our viewers, is when you eat less carbs.
Less carbs, yes. So you reduce the sugars, the fats. Yeah, you just...
So some of those foods, break it down for us, Doc. Like what? Eliminate bread, white bread?
Well, the white and the brown is very debatable because they all have the same calories.
True.
So it's just the color.
Eliminate bread.
Eliminate the simple carbs.
Okay, margarine, blue band.
Yes, the fats now. Eliminate the fats. Eliminate the simple carbs.
Yes.
So if you can find an alternative.
Soda.
Yes.
I'm trying to break it down for our viewers. Eliminate mandazi.
For the veggies and the soup. Now it should be the opposite.
It should be the opposite, eh?
The big plate should be now the proteins, the veggies.
So
and the...
are you saying there's nothing wrong with meat?
There's nothing wong with meat.
Also, meat and diabetes don't go hand in hand?
No.
For real?
Because
proteins don't spike your sugar?
They don't. What spikes now the weight is the fat. So if you're doing fatty meat or deep fry, or meat is not supposed to be cooked with oil. So there are people who fry the meat. It's very oily. You put a lot of grease. Yeah. That becomes a problem. That's why now you start saying the meat has the problem, but it's not the meat. It's just how you prepare it.
And it's funny you should say that. Do you know most of our diet is comprised of rice?
Yes.
and ugali. Ugali is what? Cornmeal. Yeah. That's the staple diet of a Kenyan person. So what do we do, Doc?
You just reduce the ugali.
Reduce the amount.
Focus on the proteins. And this has to go hand in hand with the activities you're doing. Your body even will tell you, because as human beings, you're supposed to be active. Yes. We are the only mammals that can outwalk every other mammal in the planet.
Wow, I didn't know
we can outwalk a horse. Wow. If I walk, you come from here to Nairobi with a horse, the horse will die at some point.
Serious?
But you will keep going.
Wow.
As long as you're hydrated, you have the energy. Walking for a human being is given by God.
Yeah.
You can walk as far as possible. No other animal can outwalk you.
So God gave us legs to walk.
To walk.
And when you walk, you burn calories. You are basically taking the... Okay, so what you're saying, when you work out, whether you're walking or jogging, all the sugar in your blood is being placed to your muscle cells. It's being converted into energy. So that means there's no excess sugar in your blood. So physical activity, that's how it helps with diabetic management, isn't it?
Yeah, so you're supposed to be lean. There are some features that we are seeing it in the 21st century which human beings should not have. Human beings should be lean. There should not be fat around the stomach. That one is illegal.
Wow.
There should not be pot bellies and a lot of fat around this area. Human beings are supposed to be lean because they are given for the activities.
So away from this narrative that says that you need to have a pot belly to show that we're in Bazoo.
That's a disease. That's a disease. Buy yourself a disease and call it status.
Is it true that a big belly is a sign of pre-diabetic?
No, it's a sign of
insulin resistance.
No, it's a sign of diseases.
Not just one.
Yes.
For real?
Yes, because that is just a visceral fat covering your organs.
Visceral fat, is a doctor. is the fat underneath your skin, isn't it?
Yes. Yeah, it's just fat around the same way if you are to
around your organs.
Yeah, if you are to let's say slaughter a goat, or there are some fats you'll say this cow was not healthy.
It's around the heart, the liver.
Exactly, around the vital organs, around the intestines.
So when you have a belly, it shows you have a lot of that visceral fat.
Yes.
It stifles your organs.
Yes.
Yeah, which should not. So a man, a Homo sapien should be lean.
They should be lean.
Yeah.
They should be not thin but lean.
Lean. There's a difference.
Muscular.
Yes.
Fit, flexible, and they are able to support themselves. So you don't have to remove certain sounds when you're bending down.
Yes.
You don't have to run 20 meters and then you're like...
You can tie your shoelace with no problem.
Shoelace without a problem. So physical exercise, basically, that's what you're saying. Like everybody, even if we have constraints in our activities where maybe the kind of job restrains you, but you can always get 2 hours a day where you work out. Either you take a jog, you use equipment, use a treadmill. So the technology is ruining our foods technology is fixing things like how far you can run by just using a treadmill, weightlifting, all that. It helps because you need that activity to strengthen your bones, your muscles, your organs, your heart. Your heart needs that exercise to stay healthy.
It's a muscle, it should be exercised.
It should be exercised, so you should at least be out of breath once a day.
I like that.
You know, just find yourself out of breath, not by being too unfit, but by straining to do something you have not done. So if it's running, if you are used to jogging, your body will get used to jogging and you can become fat even if you're still jogging. So you have to always turn it up a notch by running, weightlifting. Because
your body has the ability to adapt.
It adapts.
So Doc, are you saying that even if you have genetic traits, if you exercise and eat right, you can actually prevent yourself from having diabetes?
Yes, you can prevent yourself from having type 2 diabetes. And if you're pre-diabetic, you can reverse it. So pre-diabetic are the most likely in that list of diabetes, because it means yours is definitely reversible. It can be reversed by just lifestyle changes, or you're put on medication that will help control the sugars. And
are there signs of a pre-diabetic person we can know?
Same signs as the other types. The frequent urination, the tiredness, all that.
Those are also signs of pre-diabetes.
But most people don't have symptoms, so they are not.
There's no symptoms with pre-diabetes.
Yes, sometimes they don't, so they have to be tested, and they're told, "Oh, your sugars is abnormal. Let's do it again. Let's test this. Let's test your organs."
How often would you tell someone who is healthy to have a fasting blood sugar test?
Anybody who has an excess BMI, somebody who is overweight, slight or excessively overweight, should have a blood sugar test at least every week.
Oh, for real?
Yes, because they are the most at risk. They're the most predisposed because of their lifestyle, their weight.
So fasting blood sugar means you go to bed, you wake up before you eat anything, even a cup of water or anything, you go and have the blood sugar test. That's the fasting blood sugar.
Yes, that's the fasting blood sugar. So if it's okay, then it will come again. And then you do either the HbA1c or you go eat, and then you come and get tested while you've eaten. So if food spikes your sugar, then you're told to be pre-diabetic.
Another debate that is raging is a fruit okay with a diabetic person? Because there is sugar in fruits.
There is sugar in fruits, but fruits are very diverse. We have different type of sugars. The most known is the simple one, the glucose. So there are some fruits that has the glucose. Something like a banana can spike your sugar, but an orange can't. An apple can spike your sugar, but pineapple can't.
Oh, for real?
Yeah, so there are those fruits, and then it's not all the apples. It's you hear diabetic people eating green instead of red.
Serious?
Eating, so it's not all the fruits that can spike your sugar.
So someone who is pre-diabetic or diabetic should avoid bananas?
Not avoid bananas, just okay, in medicine we usually call it portion control.
Okay.
So you don't need to do 4 bananas.
Just
it's
one.
impractical.
1
banana is enough. If you're diabetic, do the small one and not the very sweet one. So there is that list of food that nutritionists give. They tell you, avoid this, use this, change this to this.
And I agree with you, because I don't know whether you love watching tennis. During they're having their breaks, most tennis players take a banana.
Yes, for the sugar.
It's for the sugar.
Yes.
So you can imagine if you're not active and you're taking like 2, 3, 4 bananas daily, of course it will spike your sugar.
It will spike your sugar.
But the thing with fruits, they have fiber.
Yes.
So if you avoid those fruits that are high glycemic, the glycemic index is high, you are okay.
Yes.
Like pineapple, green apples.
Green apples, melon. Melon is the best.
Oh, is it?
Yes.
What about sweet melon?
Sweet melon is also good. Portion control, obviously. So depending on the size, just a piece is enough. What we usually encourage is diversify your fruit intake. Don't lean on one fruit. Today, try a salad of oranges, bananas, avocado, melon.
What about berries? Although they're expensive, berries.
Berries are expensive. Some berries are very sugary. The grapes and the blueberries, they have quite a high glycemic index. So even those ones you're told to take portion. In proportion, 2 or 3 pieces. Yeah. And then you have to like space between the meals. Kenyans, I don't know who told us that you do very big meal, big ugali, a whole fish, a bowl of veggies, and then after that now you do oranges, apples, all of them, bananas.
Unawekewa chapo, rice, veggies, alafu hapo unawekewa kimelon kikubwa. I think the way our portions are out of
they're impractical completely, because you need some space.
And then unapewa soda hapo hivyo.
So those are things you're supposed to give athletes, you know. If someone is doing a rugby match or football or a marathon,
because they need a lot of
give them that kind, even the soda and everything. But now if it's a wedding, you've been sitting from morning to afternoon, and then you're doing that, it will mess you up.
It will mess you up.
Then doing it on a regular is now the problem. That one time is okay because your body can take care of itself. But now if you keep jamming junk on yourself, always the bad proportions, always the bad food, always the bad chemicals, your body gets tired and it starts to give in, and now you get sick.
Tell us the relationship between the cooking oils we usually use to make our food and these lifestyle diseases.
Wow, so cooking oils are very controversial. First of all, scientifically, the seed oils, they call it vegetable oils. They have not been seen or proven that they are beneficial to human beings.
At all.
At all. They were initially discovered to make grease for the machines.
Are you serious?
Yes. So there is nothing they add in your life. They don't help nutritionally, don't make you fatter, they don't, they're not there to give you energy.
So why do we use them then?
I don't know. I think it was just something that happened in between manufacture of those things and the marketing. Because
I don't know who told us we need these oils when we are cooking food.
They are not necessary, and they're not beneficial. They are in fact very harmful to you because they get stored as the visceral fats. They affect the organs. They release a lot of free radicals in your blood system and cause
free radicals. Our viewers are those things that predispose you to cancer, isn't it?
Yes. And they cause organ dysfunction because they're not supposed to be there. They're just residue of a metabolic process that happened unnecessarily.
The reason I ask you that is when you look at the shopping list of an average Kenyan home, mafuta ya kupika lazima iwe. And I've been thinking about it because I've been researching, Doc, like I've told you, and I realized these vegetables are very harmful.
They are.
And do you know it is possible for you to make food without necessarily using vegetable oil? There's something known as functional eating. Functional eating, you eat because it is fuel for your body. Most of us eat. we live to eat instead of eating to live. So functional eating means you put the right kind of food in your body because food is fuel. When you have that mindset, then you're very careful about what you buy on the shelf. Because when you go to a supermarket, these brands are mainly the vegetables. And ile kitu inasumbua most of us is mafuta ibe itapanda, but there's no benefit like what you're saying. We should be careful with them.
We should be very careful.
What is the alternative?
The alternative for seed or vegetable oils, it's always the animal fats.
I love you mentioned that,
If you have to use oil in your food, use the animal fat because your body is able to digest that fat and turn it into something beneficial. And you do not put it in something that already has fat. So you do not put it in meat. You do not put it in vegetables. It's not necessary. Vegetables are better off steamed.
I know.
So, there is a greasy salad. It's very unnecessary. Eggs, they're not supposed to be fried, but frying them is okay if you use the right oil to fry it. Animal fat like ghee, it's very well known.
Very good for you.
And it's very good for you, and you use it in very small amounts, so it lasts longer than the seed oils.
I had a grandmother back in the day. there was a meal called in Kikuyu gojagoto. That means they would take, if you slaughter a goat or a lamb, there's that oil you harvest.
Yes.
And they would store it. Naiko in Arabika. So what happens? She would make ugali, and the ugali was very tasty because you take that ugali and cook it in that cake. So what you're saying is very true. Animal fats, contrary to what you've been told, is the better option.
They're the better option, and I like the Maasais because they've actually, most of them have not conformed to the westernized way of taking food. You find that they cook with this fat, they drink the blood,
and they're very lean.
They do milk, no fertilizers, no GMO, nothing.
And they're very lean.
And they're lean.
Yeah.
So if there's a problem with eggs, milk, meat, those people would be the first ones to be affected.
I know.
Yeah, but if you look at them in the research, they're very lean, they're healthy, they're strong, they live long, because their body has not been polluted by this mass production of things.
And of course, it's important our viewers know things like crisps are made with those vegetable oils, isn't it?
Yes.
The things you buy on the shelf, I call them dead food. Anything that is packaged is dead food. That means there's no nutrition or benefit.
Yes.
So we should have living food. Anything you can pluck from the ground, wash it, and just basically, in a nutshell, eat it. Steamed cabbage, this is living food. So most of us eat dead food, carbs, pizza, deep fried chicken. It tastes good, but it doesn't add any value.
It doesn't add any value to your life. So diabetes becomes more and more cumbersome to the human race, because animals don't suffer from this diabetes. We give the animals the right food. If
oh, by the way, that's important. They don't suffer from.
They hardly do, unless it's these funny breeds that are made.
Hybrids.
The actual breeds are there. The kind of foods they eat, their body is meant to manufacture that. So even as human beings and as omnivores, because we are not herbivores, we are not carnivores, we're supposed to have a balance between the two, between the plant-based diet and the animal-based diet. So there should be a balance, and we usually help people develop things called diet plans, where we give you not just a one-time talk about these things, because they are complex. It's just a lifestyle change, where now we need to pinpoint those things that you use in your life that come and destroy you. For example, there's something as simple as sleep. Sleep has become a conversation. Sleep can lead, lack of good sleep can lead to diabetes. People did not know that.
I didn't know
that. If you sleep 2 hours, 3 hours, 4 hours, your body has no time to rest. It has no time to repair.
Wow.
So your immunity just goes down, and your body starts attacking itself because you're on overdrive. So you break down the same way a machine needs to rest to, kind of cool down. It needs servicing. So for the human being, food is the fuel, sleep is the service. How long should a person sleep? Average? It depends with the age. So if you are young and active, 6 to 8 hours is okay. If you are at that age, you are over 40, 50, then you should do over 8 hours, maximum 10. Your body will your brain will actually tell you, I'm ready to wake up. So we have something built into our psychology. It's called a circadian rhythm, where your body tells you this is the time to sleep and this is the time to wake up.
Is it?
You don't need an alarm.
It's like an inbuilt alarm clock.
Yes. You don't need an alarm. And even as medics, we are very notorious of not sleeping, because
the nature of your work,
you're trying to
do as much as you can.
As much as you can with little time. So that also kind of builds a lot of stress in your brain, and your organs respond to that stress.
So sleep is important in managing and in preventing diabetes.
Yes.
So to those of people who say, oh, lazima ni hustle, take care of yourself. You
take care of yourself, because there's always that period where you can do it very well. You sleep 2 hours, 3 hours very well. But you'll get to a point where the body will refuse to wake up. And now you start getting issues with dementia. You start getting issues with memory loss.
Because of lack of proper sleep.
Yes, lack of proper sleep. You start seeing very blurry, astigmatism, all that. So lack of repair, the body, giving the body time to repair itself, because you eat and then you sleep well. You eat well, you sleep well. The body has enough fuel, enough amino acids, enough glucose to repair itself during sleep.
So sleep, what you're saying is when you sleep, it's our body's way of repairing and healing. Repairing and healing. So if you don't rest, your body doesn't have time to repair and heal.
Yes.
So that's why sleep is important.
Sleep is important to just take care of that wear and tear, and it usually starts psychologically before now it manifests physically.
Yes.
Yeah. So depending on your work and exposure, because people, let's say you do mjengo where you're exposed to a lot of dust, a lot of noise, a lot of light, the brain needs a lot of time to repair. Yeah, you'll need those 8 hours, 10 hours to just repair. So you sleep early, waking up early is not a problem. That's why the sun sets at 6:30,
rises
at 6:30, because that time you're not supposed to be doing anything. So we are the ones who are disrupting nature, and that becomes a problem.
True.
Yeah, so even if you sleep 12 hours, there's nothing wrong with you.
Yeah.
As long as the day 12 hours you're doing something.
Yes, you're productive.
You're productive in those hours.
That's amazing.
Yeah.
When it comes to oils, because we mentioned animal fats, are there oils that are healthy, plant-based?
Plant-based, yeah. Olive oil is known. It's from the research we see that olive oil, they call it extra virgin. It's good if used in proper amounts, because it doesn't have. It's very expensive because of how it's manufactured. The hydrocarbons and those bad chemicals, they are removed by the machines.
Yeah.
But it's not necessary. It's good, but it's not necessary.
Yeah.
The same way things like the ghee. If you're doing ghee or the animal fat from maybe the slaughterhouse direct, it's very good for you.
But not necessary.
Not necessary if you're not having those crazy physical activities.
Yeah.
Yeah, that doesn't mean you have to boil your food. Yeah, you just find a balance where you use as minimal fats and oils as possible, and then you maximize on your proteins, you control your carbs, and you maximize on your fiber and vegetables.
Oil in nuts is good. Cashew nuts, pistachio nuts.
Yeah, the nuts oils are very good. They are not just oil. It's a combination of everything. They also have protein. The peanuts have very nice protein.
Yeah.
And they have even other vitamins, essential vitamins that help, the zinc, the magnesium, that are very essential for your nervous system, your immunity. And
so basically, Doc, what he is telling us is this: when it comes to your health, and more so when it comes to diabetes, knowledge is key.
Knowledge is key, and it's not restricted to just the medical professionals. We are willing to share. We do the research for you. You come to us, we share this with you, and we tell you because we're even trying to practice it ourselves. It's very hard, so we know. We will not condemn you or tell you you are doing it wrong. We just tell you, okay, from the research, we've done, from the experience that we are seeing how people react to certain things, try this for your body type, for your age, for your symptoms. This is what works for you.
Yeah.
You know, so it's more of multidisciplinary. The same way you go with your car to the mechanic, and the mechanic diagnoses and tells you, okay, these wheels, they're not good for the road that you use. So we do the same. We tell you, your body, with the work you do, these are not the right food for you.
Okay.
Yeah, and then now from there, if you actually need help with the medicating, now we tell you this is the right one.
On that point, tell us where you are, where we can find you. Let's take a minute and tell our audience.
Yes, mimi ni mwenyeji, Mawangige person. My name is Dr. Teddy Jenga, based in AcuCare Clinic and home-based care. We specialize in home-based care nursing, where we have a group of doctors we come to your home. This started during COVID, where people are restricted to coming to the hospital during quarantine time. So we are the ones who came to you. We brought the consultation to you. We brought the nursing services. If you have someone who is not able to take care of themselves, we give you nurses, and we give you caregivers to take care of you.
Okay.
And even if it's an acute or just a simple illness like a cold or an injury, or you need hydration, or your baby has this problem, or you've been maybe from the CS or post-op, there are services you don't really need to get from the comfort of your house. We come to you with everything.
Wow.
X-rays, ultrasound, everything apart from now surgery.
You are mobile doctors.
So we are mobile doctors.
Yes.
Yeah, we are mobile doctors. You call us, we arrange an appointment, and then we see
your social media handles.
AcuCare Clinic and Home Based, both for Facebook and Instagram. we'll share our website. We'll share our website with you guys. We are based in Kamotene, Lower Kabete Road, just near ACK St. Luke Church. ACK.
I know where you're situated.
Yes.
Your contact, your digits?
Yes, our contact is 0731 503 956.
Again?
0731 503 956.
It seems Dr. Teddy will have to have you back.
No problem.
There's so much we have not covered, and time is not on our side. But again, I want to thank you for showing up. I want to thank you because you are a wealth of resource. You're so resourceful. I love that about you. Thank you for taking time to come and share with our viewers. And we are better informed, and I'm sure we would learn how to take better care of yourselves. Now, listen, from Dimkestai Online Parish, we want to say thank you for joining us. Thank you for being a part of this family. Remember, we are praying for you. And until next time, God bless you and good afternoon.